When I'm putting a mask on, I hate it. It makes me sick. I can't stand it. But one thing that happens when I don't got that mask, oh my God, I'm so looking for it. I'm hunting it down.
Oh, no.
Oh my God, I'm going to buy them. Like, I have so many bought masks. I make masks.
Right.
Do you got a mask you can borrow me? Do you have one in your car? Like, them is the conversations now. So one thing that I do
when you go in the store.
when I go past somebody and I forgot it and people's looking at me crazy, I'll either take my purse and put the purse up to me, or I'll take my hand, cover up my face with my nose, pinching my nose and covering my mouth.
Right.
And that's just the funny thing that we're all conscious of, knowing that that's what we're supposed to have on. You know what I'm saying? The smallest things count. Thank you for tuning in to another episode of Meet the Shoe. I'm Nina.
And I am Sade.
And today our episode will be talking about the effects of COVID,
with running
the election, running the business, the effects of what COVID has done to the business, and what's our future with the new president, Joe Biden and Kamala Harris.
Oh, yeah. So, as we were thinking and we were talking about businesses, since the COVID-19 hit, a lot of businesses are working at half capacity.
Right.
So I'm asking you guys, anyone that owns a business, is COVID ruining your business? I know a lot of businesses are shutting down, never coming back. Mom and pop stores, even the large retail stores, big chains are closing their doors.
Like all the stores in the Mall of America are like, even on Saturdays, it's like at a half. I've been there on a Saturday. Some of the stores have lines where they're, the lines is like maybe 6 people in the line, outside the store because they're, social distancing, right? The restaurants aren't full. Like, I mean, it doesn't look nothing like it used to. And the mall is the busiest mall in the United States every single Friday, Saturday, and Sunday.
Yeah.
Now it's at a half and it looks so weird. And everyone that I see that's in there and they're shopping, they're really on a budget. You can't really find anything because everything is so tight. Like it's like they don't put the stuff out or they just don't have it. And what I noticed was this. Now, was that you that someone told you that when a store is open and then all of a sudden it's closed?
Oh, yes.
And they say, they have a sign on the wall. Oh, we're not going to be open because we're just rearranging the store and we're waiting on inventory. And due to COVID, we haven't been able to get our inventory, Well, what did they tell you that actually means? Well,
most places won't turn out. They'll tell you in that essence. But when I found out, when our stores closed at Apache Mall, that store, someone had COVID. It was a manager that had COVID. She was coming from this store to the store in Minneapolis. So they closed the store in Minneapolis and that one for 2 weeks.
Oh, wow. Okay. And I mean, I guess that makes a lot of sense because no one wants to be the blame. I don't want to be the blame of my business came to your business and I got you sick or you died. No one wants to blame. So people have been very skeptical of even going out, having family gatherings, but it's been so boring. What are you doing, Sade, to prevent yourself from being bored, for number one, to stay safe in your salon, for number two, and what would be the tips that you can give any other business owner, being as though you deal with traffic on from Tuesday to Saturday?
Well, what I do from not to stay not bored, me and my husband, we do a lot together.
Right.
We try and write and just create different things we want to do in the future. Like work on product line, hair line. Make sure, even if I count inventory or making new oils and stuff like that and bottling it.
Right.
So I kind of try and stay busy. And then with the clothes we have, Bossed Up Beauties, making sure everything is, not running out and advertising a lot. So it kind of keeps my mind occupied when I'm not at work. But
so you would say COVID has made you stick to the business more?
Yes,
Not
to
more
try
fun,
more business. Yeah,
okay.
Maybe more grounded and doing more research for my businesses. Right. So I think that was good for me in that aspect, but it is boring because I like to travel a lot. So I guess it just stopped me from doing the fun things, and spending my money and just trying to take that money and reinvest in something that I know there'll be a projection of more money later. Right. But in the same token, I know I have a lot of clients, so I end up having to move to online booking.
Okay. And how was that? Booksy, how was that?
It's okay.
Does that work for you?
Yeah, it works for me, but maybe some of my old school or some people that don't like doing things online, it's kind of hard for them to, download Booksy and see what's, I can do when I can do their hair. So I may have like people that's last minute or walk-ins. Okay. I won't be able to do that because by the Minnesota state law, I cannot accept walk-ins into the salon because of COVID.
These laws just come into effect due to COVID, right?
Yes.
Okay.
So it's an inconvenience and frustrating for my clients because they're used to calling me or texting me and say, hey, can you get me in tomorrow? I'm like, okay, let me squeeze you in with another client. So while this client is on the dryer, I can be shampooing and prepping you, molding you to get under the dryer and vice versa. And no, I can't do that. I can't have two people in the salon at the same time. Okay. So it's really hard and frustrating. So I'm really working at half capacity right now. And it has decreased my income.
Okay. And okay, that's just one of your business and an entity. What else have you been doing to make money, being as though you're not able to be in a salon and, stand on your feet and service? You're not, what other services are you providing to make your income, flourish?
Well, the clothing line, we have that online. So pretty much online stuff has gone up. People are shopping more online instead of into the mall. Like the mall is suffering, but brick and mortar businesses are suffering right now because of COVID. But the online e-commerces are on a rise. The clothing line, the products on online. So it's okay. It's just a hit and miss, and you just got to roll with the tides in these times.
Okay. And due to COVID, what are you hearing about the future?
Oh, gosh.
The future, especially with Biden in office now. What are you hearing?
Different stories. I think you might can relate more because you hear more in the government because you're right here in the Twin Cities. Right. But people say, we're going to get shut down again, and he's going to mandate masks all over, the states. And, everybody got their little thing they're saying. And maybe someone might say, COVID is going away after the election. But no, it's still here. Right, right. What did you hear since Biden is in office? Okay, so they're
explaining. So from what he's explaining is he is going to dedicate his time to the middle class, right? He says for the agenda, he has a lot of things for the middle class. So he's stating that in order for us to get the numbers down, he wants to go back to the way China done it. And when China did was close every single thing down for 72 days. And when they were closed down for 72 days, they came out. Nobody had it. I think they've had like 4 to 10 cases since April. So we're in the hundreds of thousands now.
Yes, we are.
We're past 1 million people catching it. Then you got to think of the people that have caught it that have mild symptoms, right?
Mm-hmm.
But knowingly, we're past 1 million people actually having it, and we're over 200 grand. People have passed. 200,000 people have passed.
Wow.
So I say we're under this big attack with this boogeyman. Now that we have the situation with Trump being out of office.
Well, he's still there.
He's still there until January, right? We'll see what he has on deck, you know what I'm saying, for what he's going to do before he leaves. But as far as like the future 2021, I think that we can just continue to do the same thing with, covering up, washing your hands, not staying confined and not staying confined in a closed-in area. But one thing that's funny, I want to take COVID into a funny state. When you forget your mask, when I'm putting a mask on, I hate it. It makes me sick. I can't stand it. But one thing that happens when I don't got that mask, oh my God, I'm so looking for it. I'm hunting it down.
Oh, no.
Oh my God, I'm going to buy them. Like, I have so many bought masks. I make masks.
Right.
Do you got a mask you can borrow me? Do you have one in your car? Like, them is the conversations now. So one thing that I do
when you go in the store,
when I go past somebody and I forgot it and people's looking at me crazy, I'll either take my purse and put the purse up to me. I'll take my hand, cover up my face with my nose, pinching my nose and covering my mouth.
Right.
And that's just a funny thing that we're all conscious of, knowing that that's what we're supposed to have on. You know what I'm saying? The smallest things count. Like they say, don't, worry about the big things, the little things count. That is so true. It's like that small piece of cloth is what's saving lives. Just stopping from spit or, germs.
Right.
But when you think about it, that's what we should have been doing anyway.
Yeah. Oh, yeah.
We should have been covering up our mouth and I cover up my mouth when I cough.
But all the time. But some people don't.
You're supposed to keep hand sanitizer around, wipe everything down. Why did it take for an airborne disease to come? This big old boogie monster killing all of, our people. And, it's just all of us running around scared to death. Can't party, can't, do anything. But another thing I want to touch on that people that are in prison, now the spread of COVID is so high in the penitentiary. Like, I don't know
the numbers
or anything, but I do know from watching the news this week that in Stillwater prison facility and in Terre Haute, Indiana, in the federal system. So in state and in federal, the numbers are extremely high because even though some places are not allowing the inmates to have visits, some are. And a lot of people are talking through the phone. It's the staff members.
It's the staff bringing it. Yeah. And you know what? I think that was going to be our next talk. Right. We was going to bring that up because with the numbers, statistics, and a couple people that have it.
Right. They got out of prison because of it.
So that'd be our next
coronavirus. Yes, that will be our next episode is that we will have numbers for you guys, and we will actually have a guest of a woman, April Williams, that was just currently released from federal prison due to coronavirus. She got her own self out.
Yeah. So that's
yes. So she will be on our next discussion, letting us know how the effects of COVID. It was a gift and a curse for her.
Right.
That she's seen friends in there get it, or I don't know if she's seen anyone die. She's going to tell her story. But that's sad to just be stuck. You're already confined away from friends and family. You're already, going through enough with dealing with, the mistreatment of being in prison, and then on top of it, that to be sick, it's too much. That is a lot.
So I know the closest I've gotten to COVID is my employee.
Uh-oh.
Oh my God. When she told me she had it.
Okay.
I was going
did she
crazy.
Explain to you how she got it?
Well, what she did, she said that her and her daughter a week before prior, they were going on vacation. They was going to Wisconsin to visit some friends.
Okay.
And as she tracked back, it was a restaurant in Wisconsin.
Okay.
And none of the employees, servers, or anything were wearing masks.
Oh, wow.
Her and her daughter wore a mask in there. So they sat down, they took their mask off, and was ready to order, eat, and whatever. So she thinking that's the only place she's been around a large crowd that she could have contracted it. So yeah, but she came, and I didn't work Wednesday and Thursday because me and my husband usually take that day off to let her work. So she came back in town that Sunday. She worked Wednesday and Thursday. Mm-hmm. She came in Saturday, get payroll, and left right out. She calls me Sunday early morning. And mind you, she was like, Shadi, I have some bad news to tell you. I'm like, what? She said, Jody, my daughter, has COVID, and I've been around her, so I'm going to get tested. She said, I feel okay. I don't have any symptoms or anything, but I'm going to go get tested anyway. So she tested. Monday, she gets the results. She called me Monday night. I have COVID. I have to quarantine for the next 10 days because they already calculated how long she's probably already had it. And I'm like, okay. She said, if you want to, you can call the clinic. Here's the number. You get to, go through the screening, and if you want to, get tested. You talking about hung up the phone? Girl, I ran downstairs to my husband. I said, oh my God, so-and-so got COVID. And he looked at me, and I looked at him. Girl, I didn't know what to do. I started crying.
And why were you so nervous?
And I don't even work because I don't like nothing in my nose.
Right.
I don't like taking pills.
Right.
Girl. So I'm like, oh my God, I gotta have something in my nose. My kids was looking at me like, are you okay? I started crying. They said, oh, Mom, it's not that doggone serious. I'm just being a hypochondriac.
Right.
Yeah. And now scratching my head to death. Girl, I didn't scratch the bald spot in my head. Girl, I'm like, oh, I hope I don't have COVID. I hope I don't do this. Oh my God, I was just going through a thing for 2-3 days. I went on and said, and I'm like, I don't want to go take the test. And I'm telling my husband, well, you got to take it with me. He said, nah, baby, you go ahead yourself.
Look, he wanted you to be, he's like, no, you going to do this by yourself.
Right.
Them people going to be investigating you themselves.
He told me, I said, well, at least drive me to the, drive through. He said, no, because once you take the test, it's going to try and make me take the test because I'm with you.
Of course.
So, girl, I was negative. I'm fine. But the thing that really hurt is because I had to think about it. I got to close my business down for the next 10 days.
Right. Yeah. Until
all her clients got tested and stuff like that. Everybody, they were negative because in the salon, we have to wear a mask. We have to sanitize that, There's things we always done, but we do it to the 10th power now. Right. Because of COVID. Right. So I'm saying, oh, the mask saved my life, honey. Right. So it's a lot when you have to close your business and I had to counsel all my clients. They wondering why, and I gotta tell them, and
right. It's just a lot. And so tell the viewers what you had to do, being as though someone was exposed, that an employee was exposed. No clients were, but an employee was. So what did you guys do to sanitize your salon? Oh gosh, we went in there, wiped down everything, pulled stuff outside and wiped it down. Pine Sol, Lysol. Where I sling bleach like crazy too. I do everything. Right. I wiped down counters, keyboards. Although she wasn't around that type of stuff, I still, wiped down the knobs, the doors, and stuff like that. Right. So right. Yeah, I mean, and I did that for the first couple days in a row. Okay. And so and being as though she's an elderly woman, right? How did it affect her?
Well,
they had mild cases, or was it bad?
Her daughter had it bad.
Okay,
but she
bad,
had kind of mild.
What, to what extent?
Fever, I think headaches and vomiting.
Okay.
My employee, she's like in her 70s. So the first day, I would check up on her. She had a fever, slight fever. She slept a lot. She did say she slept. And that's not like her. She don't sleep a lot at all. She gets around really good. You wouldn't even know she was 70. And she said she just slept.
Okay.
Yeah, and I think I dropped off some tea, ginger root, and honey, or just a concoction, and just put the bag, hung it at her door. I told her how to make it and stuff, and she was like, "Oh my God!" The next morning, I felt so good. What is that you gave me? But
right.
Hey, you gotta take care of yourself.
Right. For sure. Okay. Well, you know what? I know she was very appreciative of you looking out for her and how kind you were with, what she, had. By her getting sick and what she was going through with the thought of dying and,
you never know.
just getting anyone else sick, that's just got to be a mental strain and,
it is.
And all. But yes, y'all, thank you for tuning in for another episode of Meet the Shoe. Next week, like we said before, we will be touching on the effects of the new election with Joe Biden and Kamala Harris.
And COVID.
And COVID. Being as though that's our world, I know, you guys might be tired of hearing about it, but we need to touch on this often. So our next guest, April Williams, will be giving you guys some insight of being in prison with COVID and how the effects of COVID has touched the prison system. Thank you. See you next week.
See you.